eye, we're going to talk about leukemia. Leukemia falls under the concept of cellular regulation, which means, the cell is the basic structure of the human body. So the cells form organs, organs form organ systems form organisms. These cells have specialized functions in the body, and they divide and die off at predictable times. With leukemia, there's a mutation in the stem cell, and that stem cell no longer, mimics the function of its parent cell, and then it has an unpredictable life cycle. So this can be acute or chronic, although chronic can degenerate into the acute phase, which is where we run the risk of metastasis and death. Like I said, mutation of the stem cell. That leukemic cell has an uncontrolled division, keeps repopulating, it causes leukocytosis, but those cells are ineffective. Apoptosis does not occur the way it's supposed to, which is the death of the cell. And because of that constant production of those leukemic cells, the bone marrow becomes very congested, and then it's not able to produce the rest of the products that your bone marrow produces, like platelets and red blood cells. So it leads to a lot of problems pretty quickly with acute leukemia. There are some risk factors that are a little bit different than some of the other cancers. There is a chromosome defect called Philadelphia chromosome that can occur that has a very high incidence of leukemia. It's more common with Down syndrome patients. Radiation exposure, so that would include anybody who's had radiation treatment in the past for cancer. They're now going to be at risk for developing leukemia one day. Smoking is a risk factor. Males develop this more commonly than females, so that's a risk factor. And then, even though this is the most common childhood cancer, the incidence still increases with age. So I wouldn't say it's common in children, but as far as cancers go, it's the most common cancer for children. So the clinical manifestations, there's a lot of them, but they make sense when you think about what is happening. The bone marrow is becoming congested, and the spleen is becoming congested. So you see an enlarged spleen, and from that congested bone marrow, you'll see that lack of production of normal products from the bone marrow, which would be the platelets, the red blood cells, and the white blood cells. So you'll have swollen lymph nodes. There's going to be increased risk for infection, low-grade fever because of those ineffective white blood cells. The lack of red blood cells leads to anemia, which can cause the shortness of breath, the dizziness, the pallor. And then the thrombocytopenia is going to cause bleeding, the petechiae. So we see excessive bruising, and that's commonly what you'll see in children, is they get really tired, bruise easily, have a lot of nosebleeds, and that's because of that pancytopenia. We diagnose this through a CBC. Typically, that's when we're going to see the problem. And then to get a definitive diagnosis, they're going to do a bone marrow biopsy. They can also do genetic testing to look for that Philadelphia chromosome disorder, to see if that was possibly what caused this. So this is treated through chemotherapy, immunotherapy. Immunotherapy is more of an emerging field. They're making a lot of headway with that, though, has pretty good success rates. But still, the gold standard treatment is still chemotherapy. It's difficult with leukemia because remission is not always possible. Sometimes they end up with chronic leukemia and have to be on this chemotherapy for a lifetime. They may also be able to do a bone marrow transplant, which can be curative. And that's where donor bone marrow is transplanted. But then you run the risk of graft versus host, where the person's body will reject that. And that can be a really serious effect and cause a lot of organ damage, even death. So that would be a complication of a bone marrow transplant. So it's, effective but risky. Think about the pancytopenia. So they're going to be leukopenic, so we need to think about maybe instituting neutropenic precautions so they don't get an infection. That can sometimes be the worst effect of leukemia, is the immunosuppression. So if they're in a hospital, they need to be in a private room on, neutropenic precautions, also called reverse isolation or protective isolation, where we're wearing PPE, but it's to protect them from us. They also need to be maybe not eating fresh fruits or vegetables or raw fish. They should not be sharing utensils or bathroom supplies with anyone. They should be, have really good hand washing technique, and maybe no pepper or paprika. Bleeding precautions is for the thrombocytopenia, especially if the platelet count drops below 50,000, then we need to really start thinking about this. So soft bristled toothbrushes, try to avoid invasive procedures of any kind if you can. You may need to hold pressure on a puncture site for a prolonged period of time. Report any signs of bleeding. So make sure they know, if your stool is dark, if you note any bleeding of the gums, that type of thing, they just need to be careful because it's going to be difficult to stop that. And then also think about adverse reactions of chemotherapy and radiation, like the extreme nausea and vomiting that can occur, the alopecia. They're just not going to be feeling well. They're going to have those sores in their mouth, so all of the bad effects of chemotherapy. So complications would be metastasis. This can happen because this is traveling through the bloodstream. Hemorrhage from the thrombocytopenia. Immunosuppression is a big worry, and that's because of that leukopenia and, of course, the anemia. So those three things, the pancytopenia is a really bad effect of this. And then long-term, they may become sterile from the treatment. So that's going to be a difficult thing for this person as well. So make sure you do your readings. We'll talk about this more in class together and go more in depth with some of these medications. So I'll see you there.